Hi, I'm Joe Calderoni, Senior Vice President for Communications here at Mount Sinai South Nassau. Thanks for joining us again for another update from the hospital during this COVID-19 crisis. Just a quick update on our census. We have more than 300 COVID positive patients in the hospital right now. Census of more than 450 patients in the hospital. We have about 80 patients on vents. I'm very pleased today to be with Dr. Rajiv Datta. Dr. Datta is our Chief of Surgery here at Mount Sinai South Nassau. He is also the Medical Director of the File Cancer Center. He also is repeatedly a top Castle Connolly doctor. How many years?
Over a decade.
Over a decade as a top doctor. In addition to that, he's one of our most respected clinical leaders here at Mount Sinai South Nassau, and I don't think I'm exaggerating when I say that he's also one of our most beloved figures here at Mount Sinai South Nassau. He has, not only is he a highly skilled surgeon, but he also just has a tremendous bedside manner. And we really appreciate him taking some time to be with us today and to just talk to us about what's happening at the hospital in the Department of Surgery during this unprecedented crisis. So as you all know, the hospital is virtually filled up with COVID patients that our frontline staff is trying to help each and every day. However, we remain open for non-COVID related illnesses and emergencies. In particular, we remain a trauma center. We're really the only trauma center in Nassau County on the southern shore, on the south shore. So I just wanted to ask Dr. Datta, so if you're suffering from a non-COVID related emergency, what's the procedure here at Mount Sinai South Nassau? We are still open for business.
Yes, Joe. Thank you for having me today. This is indeed a pandemic which nobody has ever seen before. So what we had to do in the Department of Surgery is step up to help out our medical colleagues. As everyone knows, COVID is mainly a medical disease. It affects the lungs, the heart, the kidneys. So what we did in the operating room is we shut down most of the operating rooms and loaned out the equipment, personnel to the medical ICUs. However, like you pointed out, we are still a trauma center. We still take care of acute cases, so we still have a couple of operating rooms reserved for these kind of cases. So if you get trauma, it gets brought on through the emergency room, and we do have a room which is available for trauma cases. We also have surgeons who are in-house who are available to take care of these patients. Same thing.
And we're required, that's part of being a trauma center,
that is
having an operating room dedicated to trauma and having surgeons in the house.
That's right. So for 24/7 we have a room available. Similarly, 24/7 we have a trauma surgeon in-house who's available to take care of these patients. Additionally, if you have acute emergencies like appendicitis or a gallbladder attack or bowel obstruction, we have surgeons available who would take care of these patients. And obviously the procedure has changed, and that is to accommodate the patients, to accommodate the staff, and more importantly to accommodate the visitors. So the procedure now, if you have acute appendicitis, you would come through the emergency room, and all our patients are now tested for COVID. And this is to make sure that we know the status of the patient so we can protect them. We can also protect our staff and also protect the visitors. Now the visitor policy, like everywhere else across the state, we don't accept visitors at this point. So once the patient is dropped off in the emergency room, it is taken care by the staff. Now to protect the patient, all the staff wear protective masks and gloves and gowns so that the patient doesn't contract COVID from the hospital or from another patient. When they go to the operating room, again we make sure first of all the patient is protected. So everything there is wiped down clean with bleaches. There are HEPA filters in the operating room, so there's no recirculated air. So we make sure that the patient who comes in COVID negative remains COVID negative. That is very important.
And that's a huge issue, I'm sure. I'm going to give Dr. Datta a moment to clean his, your glasses are fogging up a little bit. So
That's it. Thank you.
okay. So of course that's a major concern. If I have a non-COVID related, an appendicitis as you mentioned, I might be thinking, boy, I'm going to stay home as long as possible because I don't want to get COVID.
Right.
But you're saying we're obviously very keenly aware of that issue, and we're taking all necessary steps
Exactly.
to keep our patients safe along with our staff.
Right. And then once the procedure is done for these patients, the recovery part of the patient has also changed. We recover the patient in the operating room itself, and once they are awake, we at this point do not have a floor which is completely COVID negative, only because of the sheer volume which we are getting. But these patients are then taken to a place where they are part of the hospital which does not have COVID patients. And then they are discharged
So
home.
let's just talk about that. I mentioned that we have over 300
Right.
COVID positive patients, but you're saying we are segregating and are able to put non-COVID emergency cases in a separate area.
Yeah, so these are cohorted, so the floor itself may not be completely COVID negative. However, a part of the floor would be reserved for patients who are COVID negative.
Okay.
So that they are not sent to a room where there is a COVID positive patient. So we try and protect the patients from that. And then, since there is no visitor policy, once the patient is ready for discharge, they are brought down to the front entrance. That's where the loved ones can meet with them and take them home.
And of course, the staff is very keenly aware of which patients are COVID positive and which are not.
That is correct. So that information is delivered to everybody. So everybody knows the status of all the patients, which is extremely important so that there is no cross-contamination.
And of course, you know, our staff, when they're entering a so-called red zone, that's when they would have full PPE, full protective gear.
Yes, so the protective gear starts from the head, the eyes, the mask. The one which I'm wearing is called N95, which means it protects against 95% of the particulate matter. That's the number N95, and that kind of protects the bacteria or the viruses to get in there.
Very good. And when they're ready for discharge, as you said, that's when they would come out to the front of the hospital here and be met by a loved one, and they'd be discharged as normal.
That's true.
Right.
So the operating room is still functional, only doing trauma cases and emergency cases.
And what about follow-up care, though? Are they able to come back to the hospital if they need follow-up, or?
So our follow-ups are all outpatient outside the hospital. So they are in practices in centers like Valley Stream. That's where the patients are seen, which is away from the hospital. We also have telehealth available in these outpatient facilities. So the doctors, the nurses can call the patient, actually talk to them on the phone, look at their wound on the camera to make sure everything is okay. So it's a new way of practicing medicine, but we always make sure that the original steps of the procedures are followed, which is the operation is done properly, the post-op care is done properly, but we use new technology to take care of those things.
Good. Tell us a little bit more. I know, you know, this is an all hands on deck situation here at Mount Sinai South Nassau. We have nurses who are operating in a different environment than they normally do. The surgical staff is the same thing. We're not doing elective surgery at the moment,
Right.
By and large. So there are staff that have been redeployed. Tell us a little bit about how the Department of Surgery is helping out the rest of the house during this crisis.
Sure. So once this COVID pandemic arrived, what we did was we realized what we need is staff and equipment outside the operating room. So we took out the ventilators from the operating room to make them into places where the patients can receive. Our pre-op area, post-op area, everything got converted into floors, into regular floors. Then we had nurses who are in the operating room. They were loaned out to other floors to help out. our residents, they are helping the medical flows to do blood gases.
These are the surgical residents.
They are surgical residents. Same thing with surgical PAs, surgical nurse practitioners. Everybody is deployed into medicine. And same is for the surgeons. All the surgeons, whether they are critical care trained, thoracic surgeons, neurosurgeons, they're all helping out on the medical floors to make sure that the patients, that they have enough bandwidth. To give you an idea, our regular ICUs were holding 22 vented patients. Like you just said, we are up to 80. So obviously we needed staff, equipment, support staff, physician extenders. So everybody pitched in. I am amazed to see how our staff has been helpful. Every day I get calls from people, it's not even in their specialty to do critical care. They are saying, how can I help? I have retired surgeons calling me. How can I help? It has been an amazing outpouring from the medical community.
And of course, a critical care unit, the ratio of nurses and doctors to each patient is usually much higher in a critical care unit than on a regular medical surgical floor. So we need that help desperately, right?
That is true. So on a daily basis, I have more people helping me to find out. So I never have to go scrambling looking for bodies because everybody's just lined up, which is an amazing part.
Well, good. So as stretched as we are, and we know the staff is stretched thin, you'd say that we're treading water, we're holding our own?
Yes, so every day we come in, we look at the numbers, we look at the needs, and so far we are able to accommodate. Everybody is stretched, but we are still holding true. We are still doing some elective procedures, and that is for the cancer cases. So in cancer, going by the organ side, we decide which cancers are severe. So some lung cancers, some advanced breast cancers, they are being operated. But majority of the cancers are now being treated with chemotherapy, radiation, just to hold off for the next 3 to 4 weeks till we can get back up on the feet again.
So you are the medical director of the File Cancer Center in Valley Stream, which is an award-winning cancer center here on the South Shore. Talk to us a little bit about, if I am a cancer patient, what precautions I need to take and what precautions we're taking for our cancer patients. I know one of the first things we did 3 weeks ago now, I think, was move the infusion center down to a conference room, which is a little bit separate area, and they don't have to go through the hospital to get there. Just talk a little bit about some of those precautions.
Right, so cancer, as you know, is treated by 3 modalities: surgery, chemotherapy, radiation. We found that the surgical part would be more intensive, so we are trying to push most patients towards chemotherapy and radiation. Chemotherapy is now, as you correctly pointed out, is being done in the front part of the hospital. Radiation is being done in the back part of the hospital, so they don't have to traverse the hospital. As far as the cancer patients, they are immunocompromised. They are in the special needs where they should be really cautious about making sure that they are not mixing. Social distancing is really key for those patients. They have to be extra careful about washing their hands, not touching eyes and face.
They are more susceptible.
They are more susceptible at this point.
All right. So, but at the same time, we're continuing to see cancer patients and treat cancer patients,
yes,
even during this crisis.
We are. In fact, all the discussions now, the tumor boards are done online. So everything, if there's a complex case, the medical, surgical, radiation oncologists discuss this case and try and proceed to have the least harm to the patient, at the same time continuing to treat the cancer.
Good. So it's not as if we've ground to a halt in terms of cancer treatment. Very much we're continuing to watch these patients and provide the care that they need,
that is
despite this crisis.
Yes.
Good. Very good. Excellent. I don't know if we have any questions from the Facebook audience. Okay. All right. Very good. Dr. Datta, we've heard a lot about maybe we're at a plateau. What are you seeing inside the hospital? Do you think we've hit a plateau, or?
So all I would say is that we've definitely slowed down the number of new cases coming up. However, even though we are at the plateau is still slowly creeping up, but the rate has slowed down. So it would be nice.
Now that's the rate of hospitalization?
That is correct.
Okay.
And so that would be nice to see, to start to see this drop, because the more patients who come in, they do stretch us on the resources for personnel, for instruments, for other things required. So every day the number is creeping up, but the rate has gone down.
Okay, but we are not out of the woods by any stretch of the imagination.
Not right now. Not right now.
And in terms of the public, we need to keep social distancing as we're doing now. Wear our masks when we're outside. What other advice? We can't let down our guard. The last thing we want is for this thing to go back, flare back up again.
Yes,
right?
so that's the concern, that once the word gets out that we are over the hump, you'll suddenly see activity, and which will cause a second rise. So that's really important to understand, that you should really let this go down before we break our current habits of social distancing, hand hygiene, and wearing a mask in public.
So as difficult as it is, we need you to keep social distancing, wash your hands, keep doing everything that we're doing so that we don't see a spike back up in this very aggressive virus.
Absolutely. Agree with that.
Okay.
Thank you.
All right. Well, thank you very much. We do have one question here from our Facebook audience. How are you handling appointments at the outpatient offices?
So the outpatient offices are still open. We look at the cases, whether it's a follow-up or a new patient. Can this patient wait 3 to 4 weeks? If the answer is yes, this is communicated back to the patient and the patient is rescheduled. If the patient cannot wait, then the patient is seen in the office, or lastly, if you can, you do a telehealth on the computer. So it's a combination of the three. It depends on the acuity of the requirement of the patient.
So you're doing a case-by-case basis, right?
Yes.
Depending on how severe it is, how urgent it is.
Right. So we are still receiving a lot of new consults and follow-up. Each one is looked at, and based on that we decide, should this be seen in person? Should this be seen 6 weeks later? Or should we do telehealth?
And of course, if you do have to come into an office, all the precautions we're taking there as well.
Yes, so for us the fortunate part is that all offices are outside the hospital, so nobody has to come here. So at the outpatient, everybody gets a mask, everything is cleaned down, there's social distancing in the office, and the appointments are made so that there's not much of crisscross in the waiting room.
Right, we're keeping social distancing even in the appointments.
Even in the appointments, that's
good,
important.
good. Okay, well, Dr. Datta, thank you very much. Thank you for everything you're doing for our patients in the community. We know the community appreciates it. I just want to say thank you again to everyone who came out for the caravan rally. More than 300 cars, police vehicles, fire department trucks came out. It really meant a lot to the staff inside Mount Sinai South Nassau. You really can't imagine how much it meant to our staff. So we're very grateful. Thank you again. We'll see you back soon for another COVID-19 update.
Thank you.